Thank you so much. Hello, everyone. We are here for a Discover Black Heritage discussion on health equity. The pandemic, as we know, shined a spotlight on disparities within the healthcare system. And, we've heard about how those inequities can cost the state nearly $6 billion a year. And it's not just about the numbers, it's also about the people behind those. So to talk about that, we have a couple of experts with us today, Dr. Sabrina Assoumou of Boston Medical Center and Dr. Allison Bryant Mantha of Mass General Brigham. I'll just ask you each to introduce yourselves and talk a little bit about your specialty. If Dr. Assoumou, you could just start us off, please.
Hi, thank you for the invitation to be here. I really always look forward to joining you during Black History Month. So I'm an infectious disease physician at Boston Medical Center, and I'm also an associate professor at Boston University. And I specialize in infectious disease. So I see and treat patients with a whole host of infections, including COVID, which we've been dealing with a lot over the past few years, but also other ailments, influenza, hepatitis C, HIV, name it. We take care of a lot of different kinds of infections.
And Dr. Bryant.
Hi, everyone. It's so nice to be here today with you guys in community. So I guess I wear maybe two hats in this space. So one, I am a high-risk obstetrician at Mass General Hospital. So I treat individuals and see patients for prenatal care and work on labor and delivery and think about issues related to pregnancy. And then I'm the Associate Chief Health Equity Officer for Mass General Brigham. So think about inequities and differences in outcomes across our entire health system.
Excellent. Well, we're so excited to hear from you both about a little bit about what sort of health disparities you are seeing within your specialties. Dr. Assoumou, can you start just by talking to us a little bit about maybe one or two areas where you're seeing the most disparities, and if there's any data you can share on them as well, that'd be super helpful.
Yeah, no, I mean, we're just emerging from the pandemic where pretty early on, and we could actually say that the pandemic is probably what changed and brought a lot of these issues that we've been dealing with to the forefront of people's mind, just seeing the disparities with what we were seeing in terms of who was contracting the infection and who was dying. Unfortunately, we were seeing that Black patients, Latino patients, Indigenous patients were dying at higher rates than other groups. And so that's probably in terms of when you think about, what's on the forefront of people's mind and what is the condition that has really brought this all to the forefront is definitely something that I've been dealing with a lot over the past couple of years. But then there's some glimmer of hopes, at Boston Medical Center. When we saw those numbers, we really partnered with the community, with state, local, and health departments to really, when those vaccines were available, we made sure that the people who had been disproportionately impacted actually had access to vaccines. And so we brought vaccines to the community. And we're actually using a lot of those lessons to, okay, what is it that we've learned about partnering with the community and bringing vaccines that we could apply to other conditions such as diabetes or other infectious diseases. So we're learning a lot from these lessons and trying to actually have an impact so that we're not seeing such grim numbers as we did during the pandemic.
Excellent. And Dr. Bryant.
Yeah, I think from the lens of our health system, the areas that we are focusing on that we know that there are great inequities are things like cardiovascular disease, so hypertension. That Black individuals are less likely to have their blood pressures controlled than our other individuals. We think a lot about substance use disorder. We're thinking a lot about cancer screening and mortality or deaths from cancer as our focus. And the fourth pillar, which is sort of squarely where I work clinically, is really in maternal health and thinking about different outcomes among pregnant and postpartum and post-pregnancy individuals of color. We know, and we've known for a long time, that Black individuals are much more likely to die in the context of pregnancy or after pregnancy than our other individuals. We're learning a lot more about Native American or American Indian and Alaska Native individuals who are also more likely to die. And then the state released some really excellent data. It's not excellent, but great to have the data around the risk of just becoming very sick in pregnancies. So becoming very ill around the time of labor and delivery, and those disparities persist in that space as well. So those are things that we've been really looking at the system level as well as within our clinical practices.
And the rate of this severe maternal morbidity nearly doubled from 2011 to 2020. with the complications the highest among Black people. That's according to the Department of Public Health. Dr. Bryant, can you talk about some possible solutions there might be to that, to address that issue, and perhaps any roadblocks we've seen to implementing them?
Yeah, I think it's important to think about where those inequities might come from. And so I think that we have to say the words structural and systemic racism. And so thinking about how individuals enter pregnancy in terms of their social and their health status and how we might be able to improve those things. We also have to think about interpersonal relationships and sort of how that plays out on labor and delivery, and who we might be paying more attention to, who we manage their hemorrhage differently. And so making sure we're doing some provider trainings and really getting people to understand what are the root causes of those inequities. I think barriers are always things like time and resources, but we clearly need to invest in this space because the inequities that we have right now are just untenable. We also think a lot about doulas and sort of other professional support groups that might be able to sort of bridge that gap at the bedside, and really are pleased that the state has now covered doulas as part of the Mass Health coverage package.
Excellent. And Dr. Assoumou, can you talk a little bit about what efforts are underway to train future physicians to create and build trust?
Yeah, so before talking about the physician training, I also want to emphasize, what it is that we are doing related to maternal and child health, and because maternal health is definitely, it's one of those examples that because we've had such high profile cases that have faced similar issues, it's been brought up, and people are realizing that this is truly a very devastating problem. When you talk about Black persons who are pregnant dying at three times the rate than other groups, it's really something that we really need to pay attention to. So what we are doing at Boston Medical Center, we have this program called the Birth Sister Program, and we're using something very similar to what's mentioned in other institutions, which is using doulas. And so we're using we're specifically targeting patients who are at higher risk for complications, either because of medical reasons or social reasons. And we're pairing up with a doula who's linguistically matched, so making sure that the language is concordant and also is culturally matched, because we know that we have data to show that these are very important factors. And so they provide support, provide information, and we're actually seeing some improvement regarding the rates of cesarean section, and also the rates of breastfeeding, which to me was very exciting to see. So that's definitely one of the programs that we're working on. And we also have a remote blood pressure monitoring program that's also showing some encouraging findings. So in terms of what we are doing to build trust, because the big issue that was highlighted during the pandemic is that a lot of institutions have not been trustworthy. And so it is really key that if we want to move to a different place where we're trying to reach those equity related goals, we really want to make sure that we build trust with our patients. And so what we've done at our institution is, we revamped our curriculum. The curriculum was really was audited to see, okay, how are we presenting different information to the next generation, and how we infusing not only historical context, but also sharing real stories that patients today are facing. People often talk about Tuskegee, but it's not just Tuskegee. It's what it is that patients are seeing today when they're in a healthcare setting. And so those are some of the, for examples of things that we're actually doing, and infusing really equity at all the stages of training, so that to show that we all have a role to play to affect change.
Excellent. Thank you so much for that. And Dr. Bryant, do you have anything to add there, particularly about trust, but anything else that you might want to add on to what Dr. Assoumou said there?
Yeah, I think there's been a lot of conversation also just about cultural concordance, which is sort of hard to put your finger on, but certainly in the areas of maternal health, as well as many other spaces, we know that individuals oftentimes prefer to have a provider that looks like them or comes from their same background. There was a great paper that was just presented a couple of weeks ago at our professional society meeting, interviewing Black individuals who'd had birth experiences and talking about how much they valued their Black obstetrician if they were able to have one. And so we know that we are not likely in any time soon to get to sort sort of one-to-one matching for everyone who wants it. But it also, I think, builds to those issues of trying to teach cultural humility and really understand for all providers the backgrounds that their patients are coming from. How do we learn from each other? I think that's going to be a huge part of the solution, is really understanding the workforce that we have, improving the pipeline, but also improving cultural humility for everyone who's caring for individuals.
And then, Dr. Assoumou, can you also speak about the sort of what other lessons learned from the pandemic that we can apply here?
Yeah, no, I mean, I did talk earlier about partnering with the community. I think for me, that was such a huge, I mean, we at Boston Medical Center had been partnered with the community for a while. Even before the pandemic, we had an executive position of someone whose role was really to build bridges within the community and build relationships. But what was really key to vaccinating, bringing vaccines to the community, was partnering with health centers, because the health centers were places that people trusted and that had built those relationships. So really partnering with the health centers, partnering with local and state health departments, partnering with the Boys and Girls Club to answer questions that people may have had. And so these are, like, to me, those were really important lessons that we're using to sort of build the next the next phase of our programming.
Excellent. Dr. Bryant, anything to add there?
No, I think that, what we learned in the pandemic, just before the pandemic, we were really telling individuals who are pregnant in particular to sort of empower their village to come and be with them in their labor and delivery experience, to sort of help to honor their preferences at a time when they might not be able to advocate for themselves. And then we lost some of that in the pandemic with the inability to have as many people in the village around. And so we are getting that back. And so I think that's incredibly important, because we know, we heard from individuals that was a very challenging time when people might not have, their grandma, their sister, the people that they wanted to have around them during their labor and delivery experience. And so in some ways, doulas bridge a bit of that gap, but also I think it's really important for us to understand who surrounds people and who makes them feel comfortable, and allow those folks to be in the healthcare experience, because pregnancy and birth is a very normal and natural experience, and sometimes we do a little bit too much medicalization, and so we'd love to bring it back to those that village that really is impactful for individuals.
Right. Any other areas, Dr. Assoumou, that you are seeing that needed urgent addressing at this point?
Yeah, no, I think we started mentioning a little bit, but the addressing chronic conditions such as diabetes. Again, this is an area where, unfortunately, Black patients have higher rates of having diabetes. And the important things is to think about, what are the systemic barriers that are preventing patients from having, a well-controlled condition. So we actually have a comprehensive program where we pair patients who had higher risk for poorer outcome with a case manager who's going to help them navigate the healthcare system. We also have continuous glucose monitoring. We're also addressing their mental health, because that's something that's very important, that's often not included in a comprehensive care of patients with diabetes. And we're also helping with nutrition. It is so key and important that to be able to control one's blood sugar if you have diabetes is to know what you're supposed to eat and not eat. And how can we support you to make sure that what we're recommending that you eat is actually something that you have access to, that you actually like. So kind of having that comprehensive program is actually showing some early encouraging signs in terms of when we look at hemoglobin A1Cs, which is what we use to monitor patients' blood glucose. So I think that thinking about a lot of chronic conditions, we started with diabetes is one of the ones that we included, but thinking about all the chronic conditions such as cardiovascular disease and other things. And then an important point, when I think about, we often talk about trying to reach health equity goals. I think that an important aspect that we don't often talk about is what is the root cause of what we are seeing. Wealth. Building wealth is at the root, making sure someone has a job so they actually could have access to healthcare and actually pay for healthier foods. So what is it that we're doing? So we have the Street Cred program, which I love this program because it was actually the brainchild of trainees who noted that a lot of their patients that they were seeing in clinic needed help with completing their taxes and having access to the child earned tax credit. And so during the actual visit, there was an opportunity to actually help people complete their taxes so they can actually get access to funds. And then this led to actually the Economic Justice Hub, which we're very excited about, where we'll be helping people with getting information about financial information and also even getting jobs. So thinking about economic mobility. So I think that actually addressing wealth and how is it that we invest in helping people increase their financial situation is actually an important piece of the puzzle.
I'd love to piggyback that on a little bit. I think the words that we haven't necessarily used, and it's always a little challenging to call them the social determinants of health. I think that calling something a determinant is probably not right, but maybe unmet social needs. So I think that there's a role for so much of that in healthcare that we have not traditionally focused on. So really understanding the context of where people eat and live and play and how that impacts their health outcomes is so incredibly important. And so I think we're all doing a lot more screening for that these days and hopefully being responsive.
Excellent. Any other issues or solutions on any of the topics we've covered so far before I move on to another question?
No, I think I just would add that idea that, we are both providers, we're both health, doctors, but we can't solve it all. I think the idea that there's many other folks within the healthcare system that will be part of this solution. So the idea of community health workers, community resource specialists, individuals that come from the same communities as our patients and our community members will really go a long way to really connecting individuals with resources and trying to get them to their best health selves.
Dr. Assoumou.
Yeah, no, I was gonna say I totally agree with that, and I think thinking about who's at the table, how do we partner with everyone, with the community? And I think the approach that we've had is actually listening and engaging our community and our patients. We often think as either healthcare leaders or healthcare clinicians that we have the solutions, but one thing that we're focusing more on is asking our patients. We've done a lot of qualitative interviews trying to understand what is going on and what are the solutions that our patients think that we should be sort of trying to use to sort of solve this problem. So I fully agree that everyone has a role to play and actually helping us reach our goals.
Excellent. And I think one way that I think that is kind of attempting to get at what you guys are talking about with sort of the community effort here is the Health Equity Compact, which Dr. Bryant, I know you are a part of. Can you just talk a little bit about what that is and some important subjects that you guys are focusing on right now?
Yeah, so as you mentioned, I am a proud member of the Health Equity Compact that's been in existence for the past couple of years. And it is an organization of about 80 strong, now sort of ever-growing healthcare professionals of color who are really trying to drive health equity across the Commonwealth. And so the group has been involved in a number of different efforts. You mentioned that sort of $6 billion sort of cost of health inequities. And so that group was helpful in working with the Blue Cross Foundation to put out those data. And then really importantly, the group has sort of proposed legislation to the state called an Act to Advance Health Equity that has a number of different components that hopefully will drive the state towards greater equity. So things like, how do we use our data, right? We can't improve what we don't measure. So how do we standardize data collection and sort of agree on sort of key metrics and what health equity means? And then really thinking about, as we talked about before, how do we diversify and sort of strengthen the workforce to be responsive to some of these? And so I think it's been a great boon to the Commonwealth, and it's getting a lot of attention, I think, well-deservedly. And so I would say to everyone, just keep your eye out for the Health Equity Compact and the ways that group can sort of help to drive to our mission.
Excellent. Thank you both so much. I just want to give you guys an opportunity to bring up anything that I haven't asked about or that we didn't maybe expand upon as much as you might have liked. Dr. Assoumou, I'll start with you on that.
Yeah, no, I want to underscore the excitement that I have about the Health Equity Compact. I'm excited to live in Massachusetts, where there's such a group. I have not heard of a similar group other places in the country in terms of where you have healthcare leaders of color who are putting together a roadmap for how we are gonna definitively trying to address this issue of health equity. So I'm very excited to see that. And other things that are really key is, we talk about systemic issues and systemic racism, and to really have an impact, you need to go to at the policy level. You need to really have policies that are going to improve the situation. So other things that I'm really excited about when I heard about that legislation was, number one, having a secretary of equity. So someone at the executive level whose job is actually to help lead this effort and make sure that they're at the table where decisions are being made. I think that that's really important. I was also very excited to hear about funds for safety net hospitals and clinicians in the community to really help us tackle health equity, because we're going to need all the help that we can get to make a difference. And actually thinking about the other thing that I was excited about was thinking about education related to health equity and how do we build that pipeline, that workforce. So I'm particularly excited about having such a group here in Massachusetts that's hopefully going to help us get to the next phase.
Awesome. Thank you, Dr. Bryant. Yeah, go ahead.
I will just echo that, sort of feeling grateful that we live in Massachusetts in some ways. I think that Massachusetts is often at the forefront. So yes, the Health Equity Compact. We also have a public funder that really has gone all in on health equity with an incentive program for hospitals, really holding their feet to the fire to health equity tenants. And so grateful for that, but there's lots of work to do. So we can't rest on our laurels here in Massachusetts. And I also would just echo that notion that communities have many of these solutions within them. So I think we need to also draw on the resilience and the joy within the communities in which we serve to really pull those notions forward so that we can get to where we're hoping to be.
Awesome. Well, so like Dr. Assoumou said, policy and lawmaking is a major part of making meaningful change. But also I think conversations like this are another big part of that. So I am so grateful to you both for joining us today. And thank you so much. We look forward to seeing the great work that you guys continue to do.
Of course. Thanks for having us.
Thank you.